Welcome, I'm Aaron Dean. Gender-affirming care is at a crossroads in the United States. Care for trans adults and youth depend on simply where you live. The Human Rights Campaign says that over 35% of trans youth live in states where care is restricted or banned. But one company hopes to bridge the gap and connect trans patients with the care that they need. Meet Folx. It's a health and wellness platform made for the queer community. They give patients the ability to take control over their minds and bodies. There, patients can access critical care, including gender-affirming care, reproductive health, mental health, and even primary care. It's all done from home with the help of experts and their kits that are mailed to your door. Well, how does this all exactly work? They're partnered with licensed doctors and professionals to bring a personalized experience to the patient. We're going inside of the kits with a Folx doctor to find out how. Dr. Forcier, welcome to the show. How are you?
I am wonderful because I'm talking with you.
Oh, thank you. Thank you. Well, we are so grateful to have you here to talk about folks' health and a lot of really great topics right now. So you ready to jump right into it?
Let's go.
All right. So tell our audience a little bit, how is folks' health, making it easier for people to access the gender affirming care that they need?
Well, we know historically, and with lots of research, that the LGBTQIA community, because again, there's just so many ways to represent yourself, has historically been very underserved by medicine and by healthcare. And we know that our people, our population, our community, has encountered significant bias, lack of knowledge, and even and not just on a personal level, but on an institutional and infrastructure level. So, Folks Health is trying to really combat that on a national level by providing LGBT expert healthcare across the U.S., which is really exciting in this time because there's other messaging across the U.S. about inclusion and access that is not as positive. And we're here to reassure folks that health services and good health services for queer folk are out there.
Yeah, well, let's kind of get into that last point you made. What is this current landscape looking like for someone who is seeking gender affirming care?
Yeah.
What is, with people that you've worked with, what have they said when it comes to that access?
Access is tough, and that's because number one, more and more people are feeling, I think, safe and comfortable in certain situations to say, "I need gender affirming care, and I want it not 10 years from now, but I want it now." And there's not as many providers as we would like to have, unfortunately. Folks has providers throughout the U.S. That are prescribing gender affirming hormones and managing gender affirming medical issues every day. And so, what that means is that you don't have to necessarily live in a blue state or a place where there are greater protections for transgender and LGBTQ folks. You can live in various and different parts of the US and still have access to a caring, compassionate, knowledgeable provider. And that's really important. That's an equity issue that is important for our community. That geography doesn't limit us and political divides don't limit us.
Good, good. And for someone who's watching, who may want to learn more about gender affirming care, what does the process look like when someone works with you all from beginning to end? Kind of like, I know everyone's story is different, but on a general level, what does that look like?
Well, you're going to laugh because it is just primary care. It's just healthcare.
Right.
So you would meet with your provider and you would have a conversation and you would share your health history and your family health history, and you'd share your medical goals. And then you and your provider, after sort of taking this comprehensive history and talking about overall health and well-being, would say, okay, in order to meet your goals for gender, these are the options for care. These are the medications that are available. These are referrals for electrolysis or laser, for surgery. This is where you can get your name changed and your gender marker changed. So there's sort of this comprehensive look at, what can we do to help you affirm your gender in a really positive experience with us at Folks. And Folks just doesn't have like a, say a single clinician providing the care. There are navigators and support persons that will help folks like find local referrals. We have library articles that have really cool information, that sort of get to the truth in the science and the medicine behind some of the stuff we do. There are groups that Folx offers. There's teaching groups, so a group of folks will learn how to do self-injections together, and other ways of building both health education and community. And it's a nice sort of community itself.
Yeah. And you brought up a really good point at the beginning of that state. You said gender affirming care is healthcare. Is healthcare.
Yes.
So how can we as a society, make sure we continue to get that point out that this is healthcare. That's what it is. How can we continue to, speak of this in the proper ways to make sure that people understand that that's what this is?
Sure. So I guess I would go to something when I talk about, say, gender development with children. I'm in an audience of professionals or adults, and I say, raise your hand. How many of you have dealt with gender in your life? So everybody raises their hands, right? So gender impacts all kinds of aspects of our overall health. And we know as scientists and biologists that no one person is exactly the same, their biology, nor their gender identity and other aspects of their identity. So that just makes sense. And when you're talking about someone's gender and you're talking about someone's health, there's an interplay, and that interplay is going to be really unique to that person. And as a provider, as a medical provider, my Hippocratic oath is I will listen carefully to you, and you will tell me your story, and together we will work so that we can come up with a plan that is the safest, healthiest, most affirming plan that makes sense to you. And that's healthcare. I
Right.
mean,
Plain and simple. It's
yeah,
when we
which is
talk about when we talk about some of the impacts on the patients when it comes to this kind of essential care when it's denied or not available, what do those impacts look like? How can that really impact someone?
well, I mean, and again, like think about just being any person in the world and someone looking at you as an individual or as a society and say, you don't exist. We don't recognize you. And the literature says that when people don't see people like themselves, when people don't have community, they feel isolated, they lack resources. That's not good for a whole host of medical and mental health outcomes. And so that messaging of you don't exist, you don't deserve health care, there's something not right with you, rather than saying you are a fabulous, unique person. And of course, everybody's going to be different. And in this country, we respect diversity and we respect individuals. And we're going to respect you because you're a human being and valuable to all of us in our community.
We report on the rise of anti-LGBTQ plus bills and threats day to day. But when we look at certain parts of our government and even sometimes some political affiliations, they seek to limit or ban this care altogether. You know, from your medical perspective, what is missing from the national discussion that maybe these government leaders or political pundits are missing or choosing not to acknowledge?
So I would first think the first thing I think that's missing is a moral compass for some of the leadership and decision makers. There is no science behind many of the decisions that are put in place in terms of restricting and banning gender care. That's a political move. It garners votes, it garners attention, and funding, and all those things that happen in the political world. So it would be great if there was more use of science and evidence, if there was more listening to patients. I find it really hard to understand how someone who has no experience with gender diversity, would be in charge of making a decision for an adult or a child with the support of their parents who are telling us we need this care. This care is out there. This care is studied, proven, safe, effective. But someone in a political office who has no experience with this says, nope, you can't have it. That just seems really crazy to me.
You can visit folkshealth.com to learn more about their care options. Thanks for watching. Download the app in the Apple or Google Play Store to stream us live, and you can even subscribe to our YouTube channel. For the Advocate Channel, I'm Aaron Dean.